Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to co-found SPT With Me, which is an NPTE prep platform. If you enjoy this lecture, check out more at sptwithme.com when you're studying for the NPTE. Now, for what you're actually here for, let's talk about PNF. Proprioceptive Neuromuscular Facilitation. I personally feel like this topic can be confusing because there's honestly just so much that goes into it. The first thing that you think about is probably the D1, D2 diagonal pattern with respect to the upper and lower extremities, right? I'd say this is probably the one that we're most familiar with. However, there is so much more than that. There's options for stretching, isometric strengthening, eccentric, concentric, muscle inhibition. There's a traction component, an approximation component. There's loud talking involved, timing involved. You have to be in an optimal position as a therapist. Your patients have to be able to respond appropriately when you ask them to recruit their muscles, right? So there's a lot to it, clearly. And I think that's why PNF is such a big, hefty topic. What I hope to do in this video is help explain what PNF is all about. We're not going to go into each type of PNF, but I think this is going to be a really good video for you to start on before you continue to learn about how to perform each procedure, where to put your hand, body mechanics, and things like that. So let's get into it. PNF is a therapeutic approach with the purpose of trying to stimulate our nerves to be able to recruit our muscles, hence neuromuscular facilitation. The proprioceptive part is how we do this. So to be able to stimulate the nerve to recruit our muscles, the approach used to stimulate is from our proprioceptors, specifically our muscle spindle and Golgi tendon organs. Remember that our muscle spindles have to do with stretch. Our muscle spindles sense stretch at the level of our muscles. Now, if you want to recap on what the muscle spindle is, check out my muscle spindle video. The Golgi tendon organ is responsive to tension. These are located in our tendons, so they feel our forceful contractions through the tendon. So these two, the muscle spindle and the Golgi tendon organ, they are types of proprioceptors. Now with proprioceptors, you immediately probably think that their purpose is, to tell us where we are in space, and yeah, that is one of their jobs. It does tell us location of, how far my knee is flexed or how high I've raised my arm. However, that's not its only job. The other job is they kind of just tell your brain that something is moving. So in PNF, there's definitely a lot of movement going on, right? So we have covered the terms proprioceptive, we've covered the term neuromuscular. Then there's one last word within this therapeutic approach. It's facilitation. So as a therapist, you are facilitating these movements. Us, the therapists, are identifying what particular PNF approach to use. So if a person's lacking range of motion, maybe you want to use PNF for the purpose of stretching. Once you gain the range of motion, maybe you want to use PNF to help them gain strength through this new range of motion. So you're facilitating and guiding your patient through the movements to tailor the treatment to what they need for their impairments. So far, everything that we've talked about suggests that PNF is only a physical approach. However, we all know that when we learn and we're trying to learn something new, stimulating only one of our senses is not as optimal as stimulating multiple. So during PNF, there are other senses that we incorporate. We are always talking to our patient, so we are using an auditory stimulus. We are guiding them through physical motions, so that's the kinesthetic portion. Furthermore, our patients normally have their eyes open, so if they see their upper extremity or their lower extremity moving, isn't this kind of a visual cue as well, right? So clearly, there's a lot that can go into PNF. PNF is different when you compare it to generic stretching and strengthening. When you're just stretching and strengthening, all you're doing is placing your patient into an end range motion. An end range motion that is within their physiological range of motion. You're really not doing anything aside from maybe putting over pressure that they wouldn't already be able to do themselves. However, what's different is that with PNF, when you are stretching and when you're assisting with strengthening and facilitation of muscle use, you are also supposed to apply traction and an approximation of the joint during that technique. Now, this is ideally at the level of the joint, right? However, keep in mind that anytime that you do something with respect to a joint, such as a joint mobilization, there's no way that you can truly just isolate the joint. And what I mean by that is, the surrounding muscles, the surrounding tendons and ligaments, they're also going to be affected as well. So you apply traction to the joint, it's also going to apply traction to the surrounding soft tissues. Now, the intent is to be directed to the joint, so let's just talk about that. Well, what is the purpose of directing the sensation and facilitation of traction and approximation at the joint? Well, again, it's to stimulate the proprioceptors. Furthermore, applying quick stretch is another unique feature, a PNF, that we're also going to talk about. So let's get a little bit more into each unique feature. The purpose of traction specifically is to increase the muscular response. If someone is threatened to rip your arm apart, I think your muscles are probably going to contract to avoid that, right? Furthermore, traction also promotes movement. A little pull on the joint is going to assist with a little bit more lengthening, which can promote mobility and movement. Traction also promotes pain reduction. Remember that when proprioceptors are stimulated, they actually override the stimulus that are sent from nociceptors. This is because the fibers that nociceptors travel on are smaller in diameter. They're thinner. They're thinner than those fibers of proprioceptors, which ultimately means that information from the proprioceptors will be sent to the brain first and mask the information that is trying to be sent, at least, from the pain receptors. This is the whole idea of the brain being distracted, right? This is the gate theory. Now, how this plays into PNF is that if we're stimulating the joint, any pain that might be present during a movement or during a stretch can be addressed through traction. So the person might be able to experience less pain throughout that range of motion because the brain is being distracted with the information that's being sent from the proprioceptive fibers, right? We're just moving. Even though usually there might be some pain within that range of motion, now that the brain's distracted, it can go a little bit further. So remember that traction is being performed throughout the movement. We're constantly lengthening the joint. We're pulling on it to stimulate the surrounding muscles, stimulate the joint itself. Again, gate theory, reduction of pain, all while lengthening and promoting mobility. Approximation. Approximation is the exact opposite of traction. Traction is where we pull and we're stretching the joint, while approximation is where we squish the joint together. So we're pushing the two bones together. Again, because the joint is just moving in general with approximation, same thing as traction, we're going to stimulate the proprioceptors. So it's going to give the brain all the same information as what was given with traction. Okay, so it's a lot of the same stuff as what we've already talked about. But something that is different about approximation is that if you're squishing two bones together, this makes them more congruent. So this is going to provide joint stability. So if a patient is coming to you with joint instability and you provide that stability, this is going to help facilitate better movement patterns. And ideally, because of this improved movement pattern, this should create less pain. Applying a quick stretch is another component of PNF. This is where you literally just quickly stretch the patient's respective muscle prior to performing a movement in the concentric direction. The purpose of this quick stretch is to actually promote muscle contraction, since muscles respond with greater force through the mechanisms of the stretch reflex. So think about the non-contractile components that tense up when you stretch. Think about the actual reflex that occurs when you do a quick stretch. So this helps create power with a muscle contraction. To summarize, PNF is a treatment technique that utilizes our knowledge of proprioception to improve the neuromuscular mechanism that allows us to assist with helping our patients move in the most effective way possible. Proprioception coming from the joint traction and approximation that we apply. Neuromuscular mechanism meaning the ability to use our nerves to communicate with our muscles to contract. Effective movement can occur from the therapist, us assisting with providing joint stability, providing a stimulus to contract our muscles more than normally would, providing a means to relieve pain throughout a movement, providing facilitation of the direction of movement, and providing improved range of motion, improved strength throughout that range of motion, or maybe even improved range of motion because of decreased pain. Know that these movements are performed over and over and over again so that the patient can learn the movement pattern and keep what they've gained, keep what they've been working on with you. You know, is doing it 8 times better than just once? Is doing it 20 times? Is that optimal, right? That might lead to fatigue. That might lead to recruitment of muscles that we don't want because of fatigue. So protocol is something that we are not talking about in this video, but that is just some food for thought. Hopefully the background of what PNF is makes sense now. Check out sptwithme.com when you're studying for the NPTE.